my name is Brianna. Today we're going to be inserting a nasogastric tube. First, I'm going to check my doctor's orders against my MAR. Okay, then I'm going to go into the patient's room. Hello, Mr. Jackson. I'm Brianna Wynn. Can I please check your armband? Can you please state your name and date of birth? Okay. And do you have any allergies to latex? Okay, good. No. So today we're going to be inserting your nasogastric tube, and this is going to just help with your feedings. First, we're going to apply this cloth and basin. So in case that you vomit, you could just go ahead and vomit into here. And we're also going to put you in high Fowler's position. Okay. Then I'm going to get my tape. Get 3 pieces. Okay. And then I'm going to check the patency of his nares. And no deviated septum or bleeding is present, and we're going to use your left nare, Mr. Jackson. Okay. Now we're going to measure out the tubing from the nose to around the ear, all the way down to the xiphoid process. We're just going to mark that area. Piece of tape. Okay. Then I'm going to wash my hands and apply my gloves. Then we're going to dip the tube into some cool water and have some lubricating jelly. Okay. Now we're going to go into the patient's room as well. Again. Okay, Mr. Jackson, we're going to insert the tube. I'm going to push his head back so I can see. Okay, it's going to look into his mouth to see if there's no coiling. Okay, no coiling. The patient has not coughed or gagged. Next, we're going to take a cup of water. Now, okay, Mr. Jackson, as you sip, can you please put your chest down, chest to chin, and sip, and then I'm going to advance the tube further down. Next, we're going to actually secure. We're going to verify placement first. We're going to aspirate. Got fluid content. Okay, we're going to test the pH. It's just a little drop. Okay, it's 4.5. I'm going to rehook the syringe. And here for the whoosh, I place my stethoscope over it at his epigastric area. Okay, I heard the whoosh. Now I'm going to secure nasogastric tube to his nose. Pin it to his top. And then we're going to further verify placement by going to get the x-rays. Hook this up to irrigation. will then document the type of NG tube, the length, 12 French. I also aspirated 25 milliliters of vial-colored content and had a pH of 4.5. The client responded well.
Hi, my name is Brianna, and today I'm going to be doing my IV Basic Start skill. First, I'm going to check my doctor's orders against the MAR to make sure it's the correct IV type and duration. After that, I will assess to see if my patient has any allergies, and I'll also check their current labs. Next, I'm going to prime my tubing. First, I'm going to take my alcohol prep pad, clean off the vial, attach my syringe, draw up 6 milliliters of air, and inject it into the vial. Okay. Then I'm going to single hand scoop. Okay. Next I'm going to take my extension tubing and prime it. I'm going to wipe it off with alcohol prep pad. Take my needle and inject it and prime my tubing. So I see. Okay. Now that we have that ready to go, I'm going to take my tape get 2 pieces. Split one of them in half. Make it look like a pair of pants. Then I'm going to go into the patient's room. Hi, Mrs. Jackson. My name is Brianna, and I'm a nursing student. Today I'm going to be administering your basic IVs. Can you please state your name? Okay, and your date of birth. Okay, so your armband checks out. Now this basic IV start is going to just help to administer your medication and IV fluids. Which is your most dominant hand? Okay, we're going to use your non-dominant. And in this hand, have you ever had a mastectomy, dialysis, or a previous IV insertion in this arm? No? Okay. Are you allergic to latex? No? Okay, good. I'm going to choose this, making sure to pick a straight, bouncy site, vein. Okay. Then I'm going to wash my hands. Apply my gloves. Then I'm going to apply my tourniquet 3 to 4 inches above the site. Make sure it's nice and tight. Okay. I'm going to assess for the pulse. Okay, so it's palpable. Okay. Now I'm going to take my alcohol prep pad. And wipe my site. I'm going to take my needle. Okay, Ms. Johnson, I'm going to insert this bevel up, 15-degree angle, and I'm going to stabilize the vein. Ms. Johnson, you're going to feel a big stick.
Okay, I see the flash. Then I'm going to advance the catheter. Okay, so I'm going to remove my tourniquet. Okay, then I'm going to apply my gauze. See flash pads. Add pressure. Okay. Then I'm going to take my tubing. Attach. Screw that on. Okay. I'm going to get my tape.
Remove the gauze. Remove the gauze.
And apply this chevron style. Apply this one top. Okay. Then I'm going to attach. Take my tegaderm. Now I'm going to date and time it. I'm going to secure the hub. Okay. I will then document the time and date of insertion, the insertion site, which was the left forearm, the size and type of catheter, the number of attempts required, the client's response to treatment, and the instructions that I gave. Thank you. My name is Brianna, and today I'm going to be doing my primary IV skill. First, I'm going to check my doctor's orders against the MAR to see if it's the correct dosage, med, frequency, and route. Then I'm going to see if the patient has any allergies. Next, I'm going to look at the current labs that the patient has. Now I'm going to look at my drug card and my MAR, and I see that the doctor has ordered 250 milligrams of vancomycin every 24 hours. The vial is 500 milligrams with 2.5 milliliters with a drip factor of 10 drops per minute. I'm going to complete the proportion and calculate, and I calculated 42 drops per minute. Next, I'm going to take my vial and my IV prep pad, alcohol prep pad, clean off my vial. Then I'm going to take 2.5 milliliters and inject it into the vial. Then I'm going to single hand re-scoop. Then I'm going to take another prep pad, clean off the hub, and inject it into the med bag, the IV bag. I'm going to take the bag, shake it, label it with the name, date, med name, dosage, and route, along with my initials. I'm going to take my tubing, attach the alligator clamp, make sure my tube is all the way clamped. Then I'm going to take my bag and my tubing. We're going to head to the pole. Attach my bag and hang my bag. Then I'm going to spike my bag. I'm going to give it a good squeeze and let that fill halfway. Okay, now I'm going to prime my tubing and let the liquid flow out into the garbage. Okay, now I'm going to clamp. Okay, now I'm going to hang it. Now I'm going to label the tubing with the date, time, and my initials. Okay, now I'm going to take my 10 milliliter syringe, apply my needle, take my alcohol prep pad, I'm going to draw up 6 mLs. Okay. Single hand re-scoop. Okay, now I'm going to go into the patient's room. My name is Brianna, and today I'm going to be doing a primary IV skill. First, I'm going to check my doctor's orders against the MAR to see if it's the correct dosage, med, frequency, and route. Then I'm going to see if the patient has any allergies. Next, I'm going to look at the current labs that the patient has. Now I'm going to look at my drug card and my MAR, and I see that the doctor has ordered 250 milligrams of vancomycin every 24 hours. The vial is 500 milligrams with 2.5 milliliters with a drip factor of 10 drops per minute. I'm going to complete the proportion and calculate, and I calculated 42 drops per minute. Next, I'm going to take my vial and my IV prep pad, alcohol prep pad, clean off my vial. Then I'm going to take 2.5 milliliters and inject it into the vial. Then I'm going to single hand re-scoop. Then I'm going to take another prep pad, clean off the hub, and inject it into the med bag, the IV bag. And take the bag, shake it, label it with the name, date, med name, dosage, and route, along with my initials. I'm going to take my tubing, attach the alligator clamp, make sure my tube is all the way clamped. Then I'm going to take my bag and my tubing. We're going to head to the pole. Attach my bag and hang my bag. Then I'm going to spike my bag. I'm going to give it a good squeeze and let that fill halfway. Okay. Now I'm going to prime my tubing and let the liquid flow. Now I'm going to clamp. Okay, now I'm going to hang it. Now I'm going to label the tubing with the date, time, and my initials. Okay, now I'm going to take my 10 milliliter syringe, apply my needle, take my alcohol prep pad, I'm going to draw up 6 mLs. Okay. Single hand re-scoop. Okay, now I'm going to go into the patient's room. Hi, Mr. Jackson. My name is Brianna. Can you please say your name and date of birth? Okay. Well, I'm a nursing student, and today we're going to be administering your vancomycin. Do you have any allergies to latex or vancomycin? Okay, good. Well, vancomycin is an antibiotic, and it's used to treat Staph aureus infections. This antibiotic has many side effects, which include nausea, vomiting, and abdominal pain. So if you experience those symptoms, go ahead and call me. Next, I'm going to wash my hands. And apply my gloves. Okay. Next, I'm going to clean the hub with the alcohol prep pad. We're just going to see if the vein is still patent. I'm going to flush the tubing. My needle, inject it, I'm going to aspirate for blood return. Okay, I see flash. Then we're going to push 3 mLs, the push-pull method. Push-pause method. Making sure that it's unclamped. What? Then I'm going to single hand scoop and recap the needle. Okay. Now I'm going to hook up my tubing. I'm going to prep the site with alcohol. Clamp it with alligator clamp. Now I'm going to set my drops for 42 drops per minute. We'll continuously check back with the patient to make sure that there's no pain, swelling at the site, and to see if the patient has had a reaction to the med. In 1 hour, when the med has finished, I will clamp the tubing. I'm going to detach the needle, apply a new alligator clamp, then I'm going to wipe the port, take my syringe and flush, make sure it's unclamped, aspirate, receive the flash, and I'm going to push pause the remainder 3 mLs. Single hand scoop. Then I'm going to reclamp the tubing and throw my sharps into the sharps container, and then I will document. Take off my gloves, wash my hands. Would then record the time, drug, dose, and route. The time is 3:20, the drug is vancomycin, the dose was 250 milligrams, and the route was via IV. Then I'm going to state the condition of the IV site. There was no pain, heat, or edema present at the site, and the volume of fluid used to deliver the med in the mini bag, which was 500 cc's. Hi, my name is Brianna, and today I'm going to be doing my IV piggyback skill. First, I'm going to check my MAR against the doctor's orders to see if it's the correct patient, dosage, frequency, and route. Then I'm going to assess and see if the patient has any allergies, as well as we're going to look at his current labs. Then I'm going to look at my drug card, my doctor's orders, and I see that the doctor has ordered 250 milligrams of Herceptin to infuse in 30 minutes. The vial contains 500 milligrams and 24 milliliters with a drop factor of 10. Then I would perform my proportion, and I got 8 drops per minute. Next, I'm going to take my vial of Herceptin, cleanse it with alcohol prep pad, take my syringe, inject 2.4 mLs into the syringe. Okay. Then I'm going to single hand re-scoop. Then I'm going to take another alcohol prep pad, cleanse the port, and inject my med into the port. Then I'm going to label First, I'm going to shake the bag. Label the bag with the name, date, med name, dosage, route, and frequency, along with my initials and the client's name. Then I'm going to take my alligator clamp and attach it. I'm going to make sure my tube is fully clamped as well. Now I'm going to go into the patient's room. Hi, Mr. Jackson. My name is Brianna. I'm a nursing student. I'm going to check your armband. Could you please tell me your name and date of birth? Okay, thank you. Are you allergic to latex or vancomycin? Okay, no. Good. Today I'm going to be administering your Rocephin. It's an antibiotic and it's going to help treat your bacterial infection. Then I'm going to wash my hands, apply my gloves, then I'm going to assess the site to see if there's any phlebitis, infiltration, so there's no pain, or edema, or heat present. Next, I'm going to take my tubing, label my tubing with the date, time, and my initials. So I'm going to grab my bag and my tubing and head to the pole. We're going to lower the primary. Hang our piggy back. Then we're going to spike the back. We're going to fill it halfway up the chamber, okay? And then we are going to prime the tubing and let the fluid squirt out into the garbage. We're going to clamp, reclamp. Then we're going to cleanse the hub with alcohol pet pad. Attach the alligator clamp. Okay. And then I'm going to set the time, 8 drops per minute. In 30 minutes, when the medication is complete, I'm going to go back into the patient's room, wash my hands, apply my gloves, clamp the tubing, disconnect, attach a new alligator clamp, observe and see if the primary bag is still running at 8 drops per minute. Okay. And then I'm going to take off my gloves, wash my hands. Now I'm going to document. I would record the time, date, drug, dose, and route. The time was 3:30, the drug was Rocephin, the dose was 500 milligrams, and the route was via IV piggyback. Then I'm going to state the condition of the site. There was no pain, redness, heat, or edema present. The volume of fluid used to deliver the med in the mini bag was 100 cc's. Thank you.